We're delighted to have you back. Today's discussion will cover a deficiency in an otherwise sound safety program that poses a genuine risk of harm. Let's start with our leading question. What if your hazard assessments ignore psychosocial risk factors? Workplaces generally excel at identifying visible and measurable physical dangers, but the purpose of hazard assessments is to anticipate and prevent harm to individuals before it occurs. We look for pinch points, fall exposures, confined spaces, energized systems, hazardous chemicals, and mobile equipment. And then we build controls around what we can see and touch. But what if the most significant risk in your workplace is not mechanical or chemical at all? And what if it is psychosocial? When assessments leave out factors like chronic workload pressure, poor role clarity, bullying or harassment, low support or unresolved conflict, workers still carry the risk even if the paperwork looks complete. At first, it can still look fine because the program checks the usual boxes. But underneath, fatigue grows, decisions slip, and small problems stack into bigger ones. If psychosocial risks are not assessed, your system can look compliant on paper while failing people in practice, because stress-driven errors still become incidents. Psychosocial risk factors are aspects of work design, organization, and management that can cause psychological or physical harm, which means they directly affect decisions and behavior under pressure. Common examples include excessive workload or unrealistic deadlines, chronic production pressure, poor supervisory support, bullying or harassment, interpersonal conflict, unclear roles, fatigue from shift schedules, low worker autonomy, and exposure to traumatic events. These conditions affect attention, judgment, reaction time, communication quality, and whether people report concerns or stay quiet. If someone is exhausted, distracted, intimidated, or disengaged, the chance of error increases, and higher error rates translate into higher incident potential. So when psychosocial hazards are ignored, you are ignoring the conditions that shape human performance, and human performance sits at the center of safety outcomes. Most hazard assessments focus on tasks and physical exposures, so they cover the basics like injury causes, energy sources, and likelihood and severity. That is necessary, but it is not complete, because many assessments assume the human system is stable, meaning people are rested, trained, supported, and not under unrealistic pressure. When that assumption is wrong, production pressure drives shortcuts, tolerated harassment shuts down reporting, and thin staffing builds fatigue and mistakes. Those conditions rarely appear on a typical JHA form, but they change how work actually happens, which means the assessment can look solid on paper while missing what drives risk in practice. That gap between work as imagined and work as done is exactly where better hazard assessment needs to start. Here are some helpful micro tips. 1. If your hazard assessment only looks at physical exposures, you are only seeing part of the risk picture, because workload pressure, fatigue, and organizational stress directly shape how safely work is performed in practice. 2. Treat psychosocial hazards as operational conditions, not soft issues, because factors like production pressure, poor supervision, and unclear roles influence judgment, attention, and decision quality under real work conditions. 3. When incident rates stay high despite strong physical controls, examine human performance drivers such as fatigue, cognitive overload, and pressure to shortcut controls, because technical controls fail when human capacity is degraded. 4. Add simple psychosocial prompts to hazard assessments, including questions about workload, staffing, fatigue, reporting comfort, and pressure to bypass procedures, because what gets asked is what gets managed. 5. If workers stop reporting near misses or hazards, Look for psychosocial barriers, such as fear of blame, weak supervisory support, or normalized pressure, because silence in safety data usually signals hidden risk rather than improvement. And 6. Strong safety systems measure culture as well as injury rates, because leadership behavior, reporting openness, and workload balance are leading indicators that predict whether controls will hold under real operating conditions. If you want OH&S support that closes the gap between work as imagined and work as done, and you want your safety rules to reflect how the job is actually performed under real pressure, visit calgarysafetyconsultants.ca and reach out. We help you turn rule-to-reality conflict into practical alignment by getting into the field, observing work as it truly happens, and identifying where procedures drift, where controls are being bypassed, and what operational conditions are driving those decisions, including workload, supervision, and production pressure when they are part of the problem.